In a constantly evolving world, accurate information is power. Our program offers you in-depth analysis of public policy, healthcare advances, and crucial research. Turn knowledge into action. El Bujo Investigador, your trusted source for leading the future of healthcare.
Hello and welcome. Today, we're taking a deep dive into the patient's journey through primary healthcare in Latin America and the Caribbean. It's a system with just an immense amount of promise. But, as we're about to see, it's also facing some really profound challenges.
So let's just jump right in with a number that really stops you in your tracks. 305,890. That's the estimated number of child deaths that were prevented by primary healthcare, or PHC, in just 4 Latin American countries over 2 decades. Now, this isn't just a statistic on a slide, right? It's a powerful testament to the life-saving potential of a really strong primary care foundation.
And that impact, it becomes even clearer when we start to break it down. You can see here that high PHC coverage led to a staggering 45% reduction in mortality from things like nutritional deficiencies and a 30% drop from vaccine-preventable conditions. This shows a direct, undeniable link between investing in these core primary care functions and actually saving lives. Okay, so to get the full picture, here's our game plan. First, we'll really cement the proven power of PHC. Then, we're going to walk through the patient's real-world journey. From there, we'll diagnose the barriers they face, connect those to deeper systemic flaws, and finally, chart a course for how we can strengthen the system for everyone. So, let's start with that foundation. A growing body of evidence confirms that a system built on strong primary care, well, it isn't just one option among many. It's pretty much the most equitable, efficient, and cost-effective strategy there is for achieving universal health coverage.
The core idea here is actually pretty simple. Healthcare should be easy to get to. PHC is designed to be the front door to the health system, a door that's supposed to be open to everyone, especially the most vulnerable. It's meant to create resilience right where it's needed most. But the big question is that door truly open?
So, how does this promise hold up from the patient's point of view? Because this is where the theoretical strengths of the system become deeply personal stories of either success or failure.
Just consider this absolutely harrowing account from a patient with a physical disability in Brazil. Her pregnancy was initially dismissed because the doctor simply couldn't believe a quadriplegic person could be pregnant. This isn't just a simple mistake, it is a profound failure rooted in prejudice, and it reveals these deep-seated attitudinal barriers that can turn a healthcare visit into a truly traumatic event.
And experiences like that one, well, they contribute to a really striking sentiment you see in the data. A staggering 88% of people in Latin America and the Caribbean believe their health system needs fundamental changes or a complete rebuild. Now, compare that to 55% in high-income OECD nations. This points to a huge disconnect between the system's promise and the patient's day-to-day reality. So what is creating this massive chasm between potential and perception? Let's break down the specific nitty-gritty barriers that patients run into just trying to get the care they need.
For many people with disabilities, the journey for care can end right at the front door. The lack of a simple ramp or a handrail, that isn't just an inconvenience, it is an absolute barrier that makes getting care independently completely impossible.
And once you get inside, the challenges often continue. This quote from a deaf patient really highlights how a lack of visual information or trained staff can leave people feeling completely isolated, unable to navigate their own care, not even sure if their name has been called. And this brings us right back to those attitudinal barriers. Beyond just overt prejudice, some providers actually report a lack of confidence and training in caring for patients with certain disabilities. This can lead them to just refer patients out, which fragments care and puts unnecessary stress on specialist services. And then, layered on top of all these physical and attitudinal barriers, you have the financial hurdle. In half of the low and middle income countries that were studied, out-of-pocket spending is a huge barrier. Even for people who have insurance, these costs can force an impossible choice between getting necessary care and their family's financial stability. So, it's really important to understand that these barriers individual patients are facing, they're often just symptoms of much deeper, system-level fractures that are undermining the very foundation of primary care across the whole region. A core issue here is system fragmentation. Think of it like a puzzle, where the pieces, the public system, Social Security, the private sector, they just don't fit together.
This lack of integration creates gaps, it creates inefficiencies, and it creates these profound inequalities in both access to care and the quality of that care.
And this chart from Brazil, it shows the real-world impact of that fragmentation. It's stark. Public system users are more than twice as likely to wait over 2 months for a specialist compared to those with private insurance. So a fragmented system doesn't just create inconvenience, it creates 2 totally different standards of care.
And underfunding, well, that just makes all of these problems worse. A lot of these systems are being asked to do more with less as economic crises and austerity measures squeeze already tight budgets. And that directly impacts everything from the infrastructure to the quality of the services being provided.
Acknowledging all these challenges brings us, as health professionals, to the most critical question of all. How do we repair these cracks and build a stronger, more equitable foundation for primary care? What's the path forward?
Well, the evidence suggests a path forward that's built on 4 key pillars. First, enhancing training for all of us healthcare providers with a real focus on patient-centered care. Second, improving and sustaining the financing. Third, actively working to integrate these fragmented services. And fourth, empowering communities so they can become active participants in their own health.
So what does this actually look like at a policy level? Well, it means creating stronger regulation and accountability for all providers, public and private. It means integrating quality improvement into our routine practice, not as an afterthought. It means developing clear organizational frameworks and using local data to make sure resources go where they're needed most. Ultimately, it's about building a cohesive and accountable system. At the end of the day, the evidence is clear. The life-saving promise of primary care is immense, but for millions of patients, the reality on the ground reveals a foundation that's in urgent need of reinforcement. And that leaves all of us with a critical question to reflect on in our own communities and our own practices. The journey really shows that a patient's access to care isn't just obstructed by one single issue. It's a whole web of physical, financial, and attitudinal barriers, and they're all rooted in systems that are fragmented and underfunded. Thank you so much for joining this explainer. Be sure to follow us for more insights from the front lines of health. Until next time, let's all continue working to close that gap between promise and reality.